I mean, I'd just like to share some thoughts that have occurred to me during the course of today. The first one is that obviously making the most of new platforms, and I think Hopin's a platform with great potential, but realizing that potential takes practice. Well done to our fantastic speakers for overcoming some of the obstacles that they were presented with. As I say, the Rich Wood's presentation, which was particularly disrupted by some of these glitches, we will make a recording of that available to people, and we'll tell people about how they can access that. Another impression I had was a reminder of how the COVID pandemic really has catalyzed positive change at pace and accessibility and use of data relevant to social care in the same way that it has to data-based research in general. I think that perhaps social care research still has got a little way to go to catch up with more health-focused research. But I mean, I think we saw some great examples today of how people are getting there, and I guess the question is the same as the question is in general. How will we maintain this this momentum post-COVID? Because hopefully, we will soon, with a bit of luck, be entering the post-COVID period. I think the presentations today have illustrated that, I guess inevitably, and this is particularly true in England, the focus has been mainly on adults, particularly on adults in residential care settings, for absolutely obvious and appropriate reasons. Children, particularly vulnerable children, and I'm thinking of statistics like the fact that in not children, but in young adults under the age of 30 with an intellectual disability, I mean, their mortality from COVID is around 30-fold greater than that of their peers who don't have an intellectual disability. And I think that's an issue that we need to try harder to address. I've also been struck, and a couple of people have made this point about how really we need to be thinking of enhancing the potential of the national data sets that are being brought together by David and his team through the Data and Connectivity National Core Study, through the integration of social care data and data relevant to social care settings at the individual level. And I mean, maybe David might say a little bit about that. I was also struck by the point that was made this morning that that data and every data point have got meanings for individuals. It was Debbie Keatley that made that point, and that we talk about routine data. That basically means they're routinely collected. That it doesn't imply that they are a banality or a routineness about the human situations that these data relate to. And I really liked Debbie's closing point about PPI&E in this context. I mean, it has been the case that given the speed with which some of the initiatives, the research initiatives around COVID have had to proceed at, that perhaps PPI&E has not been, I would say, factored in as much as it could be on every occasion. And I completely agree with Debbie's point that really what we have to do is just do it. Really all that remains for me to say, apart from thanks for everybody for taking part, is a series of thanks. I mean, thanks to Jan, Simon, and the Autumn Events team for hosting today's event and for holding our hands through the technical challenges that we encountered at times. Thanks very much to all our speakers. I mean, I think all the speakers have been absolutely fantastic. You know, and thanks particularly for speakers who changed when they were going to speak and changed what they were going to speak about at the last minute to accommodate slots where the original speaker was not able to speak. Thanks to all our delegates. Thanks for your participation. Thanks for your patience. And finally, thanks to Zoe Trinder-Widdis and our fantastic comms team, to Lara Edwards and Alice Turnbull for really pulling everything together behind the scenes and ensuring it was the success that it was. It's a poignant day for us today at Art West because it's Lara's second last day at Art West. She's about to move though to work with David and his team at Health Data Research UK. And I noticed, David, you neglected to indicate on your timeline that you showed earlier, you know, a little arrow at September 2020 when you poached their program manager. But I'll let you off with that. And David, if you've got anything else that you want to say, I'll pass over to you. Thanks, everybody.
John, thank you very much indeed, and a very really big thank you to you as well. I know just from even yesterday when you're in the depths of managing the primary care sort of challenges, trying to sort of juggle agendas and things like that. Yeah, just really grateful, particularly given that we've poached Lara, that you were still willing to do a joint workshop. Absolutely delighted. I mean, just a few sort of things from me really that I've sort of taken away. I mean, I think, you know, we've talked about opportunities and challenges, and it's clear there are plenty of challenges, but I think also the opportunities are in many ways endless. And I think it's a lot about making the most of the assets, and that's not just the data, that's actually also the people and the work that's already going on in this space, and how do we sort of communicate that far more sort of broadly and widely, and how do we really sort of make that case for the investment in this? You know, what are those driving research questions that really would sort of, you know, force people to sort of sit up and look? I mean, it's clearly the spotlight is on social care in a way that perhaps it hasn't been for a while, and obviously NHSX within England are doing work, and there's equivalent probably in devolved nations, but we've really got to sort of accelerate that and broaden that, I think, to really make the sort of the most of it. The other couple of points was really then around a bit about challenges, really. So similar point about, you know, a lot of focus on older adults and care homes. I think, you know, again, the home care situation for both older adults and sort of younger adults and children is a really important piece. And I think particularly I don't think we've touched at all on sort of device-based sort of telehealth, telecare, and the opportunities that sort of streaming data and things like that from their offers, which will become effectively routine data. The other one is around sort of parallels, I guess, with primary care, in the fact that we've got lots and lots of independent operators, but actually, you know, and I guess primary care has got a far more consolidated sort of supplier system of IT systems. But again, are there other lessons from how primary care data is developed in terms of sort of local research collaborations, then collaborations into things like, you know, CPRD, Q research and things like that, which takes a sort of a system view and sort of works with the practices associated with that, through then into sort of direct flows into sort of consented cohorts like UK Biobank, and I guess ultimately ending at the moment, at least, with national flows through COPI. So, you know, are there any parallels there that we can draw with the system suppliers in particular, working obviously in hand in glove with the homes or the providers themselves as the data custodians? So I think they're the sort of the closing thoughts for me. And we are on the hook to do a write-up for this. Fran's been on the call, or been on the workshop all day. She's obviously got one parallel session still to observe, and then turn that into a short report that will obviously make sure gets circulated. It'll probably be just about into 2021, but we'll get that out and around as quickly as possible. And I think the final one is really again about that data and connectivity piece, and really sort of seeing how we can use that to make the most of those assets, and where there are other data sets we should be drawing in at a national level. So thank you very much indeed, John, for being part of this.